Hello, my name is Bo Kim, and I'm excited to talk about our case study on multilingual mHealth application for immigrant populations with limited English proficiency from the Memorial Sloan Kettering Cancer Center. Limited English proficiency refers to any person who reported speaking English less than very well, as defined by the U.S. Census Bureau. 9% of people living in the United States and 25% of people living in the New York tri-state area are reported to have LEP. Given the high number of populations with LEP, the Memorial Sloan Kettering Cancer Center, our large academic medical center based in New York, was motivated to investigate the language and cultural barriers confronted by this population. Prior work on health equity demonstrates that limited English proficiency is a social determinant of health that contributes to health disparities in the US. Moreover, these user groups are less likely to use a patient portal than those with English proficiency. However, our user experience team at the hospital's Digital Informatics and Technology Solutions group had little understanding about how this user group interacts with patient portals. We wanted to learn if offering the patient portal beyond English can bridge the digital divide experienced by this user group. And we were curious whether the language preference feature in a mobile patient portal app could increase their portal adoption. We conducted semi-structured interviews and usability testings to first understand this user group's existing barriers with using the patient portal, and second, evaluate any usability issues with this new feature and understand how this user group perceives patient portals offered in their language. Each study took about an hour in total, and 5 patients with LEP who met the recruitment criteria participated in the study. For this study, all of our participants were Hispanic who spoke Spanish as their primary language and reported that they don't speak English very well. We were lucky to collaborate with the Immigrant Health and Cancer Disparities Service. This is a department within our institution focusing on cancer disparities and is a national leader in advocacy related to language access to healthcare. A professionally trained medical interpreter from the IHCD group, who was bilingual in Spanish and English, collaborated with us closely to conduct the study. Here's how we collaborated together. UX researchers who did not speak Spanish initially developed a study protocol in English. Then, the interpreter from the IHCD service translated the protocol into Spanish. Since the medical interpreter had no prior experience with conducting usability testings, we did a few rounds of mock sessions to practice using the translated protocol. After the sessions, the interpreter and another bilingual staff from IHCD service revised the protocol based on their cultural expertise. For the actual study, we met the participants after their scheduled visit in a quiet room in the hospital's outpatient facility for their convenience. The interpreter moderated the study in Spanish and interpreted the participants' responses into English for the UX researcher. While the interpreter primarily used the study protocol to facilitate the session, the UX researcher asked follow-up questions in English when the participants gave responses beyond the scope of the protocol. In such cases, the interpreter translated the questions for the participant into Spanish and translated the responses back to English for the researcher. Here's a summary of our usability testing results when the participants were asked to complete 3 tasks. First, they were asked to log in to the portal using their username and password, and then they were asked to turn on the option to log in using biometric settings. And lastly, now that the system is able to identify the user's account, the users were asked to select the language they want to use for the portal app, so that whenever they return, the app will be offered in their preferred language. These results show that users with LEP struggle with enrolling and logging into the patient portal. During the first 2 tasks, when the prototype did not offer a language translation option, the participants needed help understanding labels in English. For example, 2 participants misinterpreted the username field as a field for entering their personal name. For the second task, when the modal appeared allowing the user to opt in to biometric login, many participants immediately tapped OK to proceed with the next steps. When we asked them follow-up questions about their familiarity with biometric login, We learned that the participants didn't necessarily understand that clicking OK will configure the setting. On the other hand, once the interface was translated into Spanish, they expressed increased trust and confidence in the information presented to them. The participants emphasized the independence and self-efficacy gained from the translated portal app. Without the translation, the caregivers with English proficiency, who were the participants' children, had a significant role in mediating patient-provider communication. Since patient-provider communication also occurs in patient portals, all study participants shared that they relied on their English proficient caregivers very heavily to overcome the language barrier. The challenge was even greater when the participant didn't live with their caregiver, who could regularly provide help when needed. These findings are really important because despite the varying English proficiency of immigrant populations, they're all often only represented by race and ethnicity in ACI research. Language proficiency is a social determinant of health that should not be overlooked. Therefore, we see future research opportunities focusing on individuals with LAP and their experience with health technology. One step towards recognizing the implication of language proficiency is to start capturing this information when reporting the participants' demographics. Given the large proportion of individuals with LAP in the US practitioners should not assume that the user is proficient in the language provided in the user interface. For instance, our studies showed that even a simple login page that follows standard design convention was prone to errors when the user does not speak the interface's language. Without testing this flow with the users with LAP, we would not have discovered the importance of offering translation settings in the login page. Our findings align with prior research on patient portals that usability barriers such as difficulty with typing a username or password may hinder the portal adoption among vulnerable populations. And our study revealed that language barrier contributes to usability barrier at any point in the user journey. Therefore, translation settings should be presented as early as possible to reduce any language barriers in health technology. By opting into using the patient portal in their preferred language at the beginning of the enrollment process, patients with LAP will require less support from caregivers to access the patient portal.